Like many of us, former gold medal winner Bruce Jenner has dealt with knee problems his whole life. It started in college.
Actually, 1968, I was trying to block a punt and went in, bang, and this guy hit my knee, and that was the beginning of my knee problems right there. A few months later, I had to have surgery. Having the surgery made the stability better, but I always worried about it. If you notice, even in the games, especially the jumping events, I'm always wearing a knee wrap on my knee. Now, at that time, when you're 26 years old, you know, you can kind of get away with that. As time goes on, you know, I mean, put it this way, that age-related decline is not all it's cracked up to be.
Over the years, Bruce tried all sorts of remedies: aspirin, anti-inflammatories, ice packs 3 and 4 times a day. All provided no more than temporary relief.
It came to a point where I had pain every day. I mean, just, you know, getting out of bed, it would take me, 10 minutes, 15 minutes, just to get my knee warmed up to see you can kind of move around and get going. Simple things like going upstairs, would be difficult.
The problem with arthritis is that your cartilage wears away, but it's not just the cartilage problem, it's also the fluid in the joint. So when you're young and healthy, the fluid that's in your joint is very lubricating. It has a lot of viscosity, it gives you the cushioning, and as you develop arthritis, that fluid changes. It becomes very thin, it loses its lubrication, loses its cushioning properties.
It got to the point where I'm thinking, okay, boy, do I need knee replacement? I mean, is that what I'm heading for here? I don't particularly want that. I like my old knee. I don't want to deal with the pain of it, but I like my old knee. I don't want a big bunch of metal in there and all that kind of stuff. I went to my orthopedic surgeon and said, what can we do here? And we talked about euflexxa. I said, let's go with it. It's 1 injection, once a week for 3 weeks. I went in and got my first injection. Kind of, a little apprehensive. Does this hurt real bad or anything? I went in and it was not bad at all. I mean, yeah, it hurts a little bit. Time you get stuck, it's a needle that goes in there. But the benefits definitely outweighed, the few seconds of that needle going in there. I've started feeling relief, I would say, within the first injection, between the first and second week. The amazing thing was, my knee just kept getting better and better with time. It was that simple. I mean, I'm not taking anything. I'm not taking aspirins. I'm not taking any anti-inflammatories. And my knee is doing absolutely great. It was better than it was, 10 years, 15 years earlier. I'm part of that baby boomer generation, and I hate to say it, we're getting older. I think a lot of people don't know what their options are when it's dealing with pain with the knee. And especially in our case, euflexxa is a relatively new product on the market. And it's important for me that I get the word out and I tell people that, hey, you know what? There are options out there. You don't have to live with the pain. You don't have to get major surgery. I think it's important that people are informed.
Today, Bruce leads an active life.
I still get walks in. My wife loves to walk, so I walk with her all the time. I do some light lifting on my knee. Light lifting total body, but on my knee also. And I can still get my biking in, but I don't do the really big hills anymore. I can still do the life cycle. I enjoy doing that. Anything that I can get cardiovascular workout. I recommend this product to everybody I talk to.
Just pull it back.
The advantage for me in choosing euflexxa is, one, it fits into my lifestyle. It's so easy to do. I mean, think about it. You don't have to take any pills. It's minimally invasive with months and months of relief. It works for me. Because it's so simple, and I like leading an active lifestyle, and this gives me the ability to continue that active lifestyle. So for me, it's simple. It works.
While individual results may vary, in clinical trials, 81% of patients reported feeling satisfied or very satisfied with euflexxa.